Thank you very much. Just before we begin, I want to mention we're working very hard, long on getting a young group of people out of Peru. We've removed some, and the rest are being removed with the cooperation of the Peruvian government. Some people out that got caught up, and we are working on that very well, again, with the Honduran government's work, and they're working with us, so I appreciate that. We have a couple of other locations that we'll report to you, and we were able to get a young woman released from a certain area who was being, and we spoke to General Milley. General Milley took care of it. We went in, and we got her out, and we'll report further on that one. But it's that was rough stuff. I want to thank General Milley. I want to thank all of the people that were involved and the people that went in to get her. I want to thank you very much. As we continue, we're profoundly grateful to our nation's state and local leaders, doctors, nurses, law enforcement, and first responders who are waging this battle on the ground. It is absolutely critical that Americans continue to follow the federal government's guidelines, so important, about social distancing, non-essential travel, and hand washing. Single American, I want to just say that Senator Rand Paul, a friend of mine, he's been a great friend of mine. He's been always there when we needed him, when the country needed him. And as you know, he just tested positive. Jose Diaz-Balart, spoke to him yesterday, tested positive. And some people are call it the hidden enemy. And I think they'll all be fine. I hope they're going to be fine. But I just want to send our regards, and I think I can speak on behalf of our country, to those two great friends of mine. We're working urgently with Congress on legislation to support the millions of workers, small businesses, and industries to Americans as quickly as possible so that families can get by and small businesses can keep workers on the payroll. This will help our economy, and you will see our economy skyrocket once this is over. I think it's going to skyrocket. It's a pent-up demand. It's a built-up demand, and I guess you really have to. We want to win the war with as few, if you look at it, just deaths as possible. We want to have as few number of deaths as possible. Today I'm announcing action to help New York, California, and Washington ensure that the National Guard can effectively respond to this crisis. The National Guard, we're dealing also with other states. These states have been hit the hardest. Actually, pretty much by far, you could say the hardest. Everybody can see that. Just look at the numbers. And through FEMA, the federal government will be funding 100% of the cost of deploying National Guard units to carry out approved missions to stop the virus while those governors remain in command, so do the job, and I think they will. I spoke with all three of the governors today and just a little while ago, and they're very happy with what we're going to be doing because we'll be announcing some other things for those three states and some other states where it's hit the hardest. This action will give them maximum flexibility and safety of the people in their state. The federal government has deployed hundreds of tons of supplies from our national stockpile to locations with the greatest need. In order to assist in those areas, I approved the state of New York's request for a major disaster declaration, something which Governor Cuomo has been asking for and which I agree, and we had it done in very rapid fashion. And we're working very, very hard to get all of these things not only signed up, but completed and finished and win. The request from the state of Washington for a major disaster declaration was approved just a little while ago. Went through the process and we moved it very quickly. The request from the state of California was just received and we will have it approved very quickly. We'll be working at we're working on getting that done very quickly. It'll be done maybe tonight. We have large quantities of medical equipment and supplies on the way based on all of this to those states, including respirators, surgical masks and gowns, face shields, coveralls, and gloves, with large quantities already delivered to Washington and to New York. In addition to large quantities of supplies, I've also medical stations with 1,000 beds for New York, 8 large federal medical stations with 2,000 beds for California, and 3 large federal medical stations and 4 small federal medical stations with 1,000 beds for the state of Washington. The governors know. The supplies en route to California and New York. The USNS Mercy. It's incredible ships. These 2 ships are incredible. One on the West Coast, one on the East Coast. Will be deployed to Los Angeles to add emergency surge medical capacity, and they have a tremendous capacity. They are really something. I will say that if you look at some of the things we've been doing, we've done a presidential approval for requests for major disaster declaration for the state of New York. Approval of Title 32 National Guard activation for the state of New York. We're providing all of this at no cost to the governor. I spoke with Governor Cuomo. He's working hard. We're all working hard together. The relationship has really been amazing. The state and the 25%, we're going to be waiving that 25% cost. We're picking up, we'll be coordinating, and they'll be doing something with very special people. Mission assignment of the U.S. Army Corps of Engineers to provide support to build out alternate care sites. They're doing various medical stations of 1,000 beds. These are very complex places, actually, with great equipment and great people. Strategic National Stockpile Order, and this is as of a number of days ago, so far delivered to New York, and this is the 19th. We had the N95 44,078 surgical masks. Many have been delivered since then. Face shields, we've delivered 84,560 face shields. Surgical gowns, 68,944 to New York. Coveralls, 352. Gloves, 245,000. Just since then, the numbers are quite large, and we have tremendous numbers of companies also making equipment. For the state of Washington, we've delivered 369,000 N95 respirators, 507,406 face shields, 63,788 face shields, surgical gowns, 107,850, gloves, 240,376. And we have many, many things pending. It's actually not pending. They're being fabricated. They're being made, and they're moving. Now, for Washington, state of Washington, we have 3 large federal medical stations, 750 beds. And then you have, as I said, the approval of the Title 32 National Guard. State of California, again, to be very precise, we're going to have the approval of the Title 32 National Guard activation. And we're providing all of this, again, like in New York, at no cost to the government, no cost to the state. It enables the governor to provide robust National Guard support to the state. So they're going to have control of the National Guard. Federal government sending. These are incredible people that are being sent. We have 8 large federal medical stations with over 2,000 beds, and that's going to California. And then Strategic National Stockpile Order. I won't go into the exact numbers, but the numbers are very substantial. But we're having a tremendous additional number sent. And whatever the states can get, they should be getting. I say we're sort of a backup for the states. And some of the states are doing really well, and some don't do as well. The ones that don't do as well need more help. But these are 3 states that really do need help because they are from the private sector has also been extraordinary. I'm pleased to report that Honeywell, great company, has just announced it will immediately expand its personal protective equipment manufacturing operations in Rhode Island to produce millions of additional N95 masks. They're very hard to get. They're actually quite complex. For the U.S. government's strategic national stockpile, they'll be immediately then delivered to the various jobs for that state, probably around 500. The masks will be distributed by the government for the use of the health, safety, and emergency, and this for response workers, primarily for response workers. These are very high end. This expansion is in addition to Honeywell's action to more than double production of its existing personal protective equipment manufacturing round the clock. Today, I'm also announcing the launch of a new public-private consortium organized by the White House, the Department of Energy, and IBM to unleash the power of American supercomputing resources to fight the Chinese virus. The following leaders from private industries, academia, and government will be contributing computing resources to help researchers discover new treatments and vaccines. They'll be working along with NIH and all of the people that are working on this. But tremendous help from IBM, Amazon, Google, Microsoft, MIT, Rensselaer Polytechnic Institute, the Department of Energy's National, and they're fully in gear. This afternoon, I also want to update you on the steps we're taking to protect and serve our country's 18 million veterans. These are great people. Our amazing veterans have shown their eternal loyalty to our nation, and this is the time where they're in need, and we are going to show our loyalty to them. We're being very protective of our veterans. We're working on Indiana in particular and some other states, veterans hospitals. We're going to be very protective of our veterans. Some of them are of that very vulnerable age, and some of them obviously are not feeling well, and some of them are still suffering the wounds of war from many years ago. Yesterday, I signed vital legislation to ensure that the GI Bill will cover VSOs to describe our unprecedented action. In February, the Department of Veterans Affairs established 19 emergency operation centers throughout the country. One of the things that they've been trying to get done for many years, you all know this from following me over the last veterans accountability. Now, if it's crowded within this, if they can't get to a doctor, we have great doctors in the VA. I have to say that. We have fantastic doctors, as good as they come. But it's hard to get to them because of what was bureaucracy, but no longer bureaucracy. We've done a lot of things in that case because of we're now allowed to fire them for, I signed that a year and a half ago. For many years, you weren't able to do that. So the VA is working, and I was just told by our great leader at the VA, Robert Wilkie, he said for the first time, we get the highest marks in the history, highest poll numbers in the history of the Veterans Administration. Came out a week ago. That reasons that happened, highest in history. One of the reasons that happened is because of veterans' choice. If they have to wait online, they go and see a private doctor, and we pay the bill. And they get better. They don't have to wait 2 weeks and 3 weeks or 2 days, but they get better. And a lot of times they waited so long that they would have a problem, and it would end up being terminal because they couldn't get the kind of treatment that they deserve. It was in the history of the VA. I was just given that information yesterday. We restricted visitors' access to 135 veteran community living centers, which house nearly 8,000 veterans with chronic medical conditions, so that we limit their exposure to the virus. We want to totally take care of our veterans and letting them till after this is gone, after we've won. We began providing life-saving care to patients who had symptoms across the 171 VA medical centers nationwide. That's a big deal. Under my administration, the VA has also been a leader in expanding telehealth. Telehealth is becoming a bigger and bigger factor to cut through the red tape and make telehealth available for millions more Americans during this crisis. They can speak to a doctor from the safety of their home rather than risk becoming infected or making a tremendously long trip when, frankly, you'll speak to a great doctor right from your home. It's happening, telehealth. We're very much at the forefront of that, too. We're very proud of it. And it also takes a big burden off our system. We're also aggressively investigating a number of antiviral therapies and treatments to determine their potential in reducing the severity and duration of the symptoms. And you know how I feel, because how I feel is on Tuesday, they're going to be starting it on Tuesday morning. And we're going to have some medications delivered.
Briefly about is the Defense Production Act. And to give you the overview here, using the full power of private enterprise and the full force of the federal government, my job at the White House is to make sure tactically, working with FEMA and HHS, the American people, particularly our healthcare professionals, get the gloves, the masks, and all that. My job's gotten easier. And let me explain why. The Defense Production Act, in this context, has two primary functions. One is mobilization of the industrial base, in this case, the public health industrial base, and the other is allocation of resources, both from the supply chain.
Eternally linked by our shared national spirit. We love our country, a spirit of courage and love and patriotism. No American is alone as long as we are united, and we are united. We're very united. People are saying things now that 3 weeks ago, they didn't talk that way. We're very united. No force. We have it right now. For those worried and afraid, please know, as long as I am your president, you can feel confident that you have a leader who will always fight for you, and I will not stop until we win. This will be a great victory. This is going to be a victory. And it's going to be a victory that, in my opinion, will happen much sooner than 144 countries at this moment. 144, that's unthinkable. There's never been anything like this. And it's vicious. It is vicious. Some people recover well, and some people have a hard time. We all know that. But we will be totally victorious. We will then get our economy to a lot of great things will happen. But I'm very proud of our country. I'm very proud. I'm very proud to be your president. And it's just something that's just, you're very special people. So thank you very, very much. And I'm going to ask, if I might, a combination of Pete. Why don't you start off? Okay, please.
Thank you, Mr. President.
Thank you.
In California and New York. We understand that the states of Washington, New York, and California are the areas seeing a steady increase in COVID-19 virus cases. In order to assist with additional needs identified in those areas, the state of New York was approved for a major disaster and declaration this morning. Washington State was also approved earlier today. California submitted their request, and the President will consider it immediately. We have medical masks, gowns, face shield, coveralls, gloves, with quantities already delivered to both Washington, New York, and California. And we anticipate additional supplies to be delivered within the next 42 hours to all these states. Under President Trump's unprecedented national emergency declaration on March 13, FEMA is assisting state, local, tribal, and territorial governments, including reimbursing eligible public health officials in response to this emergency. All 50 states, the District of Columbia, 5 territories, and 2 tribes are working directly with FEMA under the nationwide emergency declaration for COVID-19. With the assistance of the FEMA regional administrators who are throughout the country, we are working to address the needs of state and local officials everywhere. States, tribal, and territorial governments do not need to request separate emergency declaration, does not authorize direct financial assistance available to individuals such as disaster unemployment assistance or other needs assistance at this time. Just a note on the USNS Mercy. Based on analysis of potential needs for hospital beds on the West Coast, the decision was made that the USNS hospital ship Mercy would have the greatest impact in California. The Department of Defense has been given that the Mercy can get into position within a week or less of today's order. Even though there are more cases right now in Washington, the projected needs for beds in California is 5 times more that of Washington. The Mercy will be used to take pressure off local hospitals, other medical needs, and not for treating COVID-19 cases. And finally, to address the COVID-19 threat as we attack the health and safety or protect the health and safety of the American people. It remains our top priority. The National Guard is especially posted and equipped to assist federal, state, local agencies while serving the public. In response to this unprecedented nationwide operation, President Trump has approved Washington, California, and New York National Guard. The President's action provide the nation's governors continued command of their National Guard forces, enabling states to use additional resources to meet the missions necessary in the COVID-19 response. The National Guard is a viable and responsive avenue to provide a much-needed asset that is state-managed and federally supported. And I want to be clear, this Title 32 activation does not work in concert with the Department of Defense, and we've had a lot of disinformation circling, and I want to make sure it is understood that this is not martial law. The Department of Defense, by way of a mission assignment, will lead this task. And then finally, we continue to respond to hundreds of requests from governors across the country in filling all their critical needs. Thank you, sir.
Thank you, Pete, very much.
Briefly about is the Defense Production Act. And to give you the overview here, using the full power of private enterprise and the full force of the federal government, my job at the White House is to make sure tactically, working with FEMA and HHS, the American people, particularly our healthcare professionals, get the gloves, the masks, and all. My job's gotten easier. And let me explain why. The Defense Production Act, in this context, has two primary functions. One is mobilization of the industrial base, in this case, the public health industrial base, and the other is allocation of resources, both from the supply chain. Now, what we're seeing on a purely voluntary basis, based on the leadership of this administration, we're seeing the greatest mobilization of the industrial base since World War II. And every day I'm working with organizations and companies, National Association of Manufacturing, the National Council of Textile Organizations, and so on, in terms of building up rapidly our capabilities to get. It can mean, for example, repurposing a factory. So Pernod Ricard called us last week, and they had 3 hurdles they had to deal with. They called my office, had to make a call to Treasury, FDA, and HHS to clear the path. We got that done that day. They started their production that day, moving from alcoholic beverages to hand sanitizers in New York, and will arrive there Tuesday to share with the hospitals over 1,000 gallons of sanitizer. So that would be a repurpose. A second example would be one that the president offered with Honeywell. Again, Honeywell called the White House asking for help from the president. And what they said is, look, we want to do this new factory in Smithfield, Rhode Island. They called me on a Friday morning. HHS flipped that immediately, and I had Honeywell moving people and equipment from Massachusetts to that facility in Smithfield, Rhode Island, and we're going to have those masks produced within 30 days, moving on the assembly chain. So my point is, mobilization is repurposing, building up capabilities. And the other portion is, of course, the Defense Production Act, sir, has given me quiet leverage. When you have a strong leader, you can take a light hand initially. And so what we've seen with this outpouring of volunteers from private enterprise, we're getting what we need without putting the heavy hand of government down. There will be possibly cases down the road, and the manufacturers have actually asked me that the White House will have to break through using the Defense Production Act. We won't hesitate to do that. The last thing I'll tell you is that I also get a lot of calls that are very disquieting. Brokers are offering millions of items, whether they're goggles, masks, or whatever, and you go through 3 different brokers, tracing to a warehouse in LA that's allegedly got a message to the hoarders. If you got any large quantities of material that this country needs right now, get them to market or get them to us. We'll pay you a fair price. But if you don't do that, we're going to come for you and make sure that doesn't happen in this country. And that would be a good use of the Defense Production Act. So I salute you, sir. You've made my job easier, and I appreciate that.
Thank you, Peter, very much.
As we do every day. And let me begin today by simply saying thank you to the American people. And thank you for the way that people across this country, 7 days into 15 days to slow the spread. The people in communities large and small across America are responding, are cooperating, are communicating, not just on behalf of their own health and the health of their president and our entire task force. Just thank you to the American people. I also want to express our appreciation to the governors across the country. The President today just announced action in New York, California, and Washington State as the latest demonstration that this administration will do whatever it takes to support the legislative efforts that are underway, being negotiated on Capitol Hill as we speak. The bipartisan spirit that's taking place there, that's reflected in all of our interactions with state leaders around the country, is a great credit to the nation. But it should be a great encouragement to the American people that your government, at the federal level, at the state level, and that is the way our system works. It's extremely important that the American people recognize that one of the things that makes America different is that we have a system of federalism, and that by putting FEMA in the lead, the President has emphasized that our response to the coronavirus is we want the people on the ground, the decision makers, to have what they need. We want states to be able to manage the unique circumstances in their states. And whether it be the legislation moving through the Congress or the efforts the President announced today, major disaster declarations, Title 32 on the National Guard, resources flowing, hospital beds flowing, we're going to continue to make sure that our states have what they need to meet this moment. Our testing, mitigation, and supplies. And on the subject of testing, as is evident to people across the country, testing is more and more available every single day. We'll be detailing tomorrow from this podium the progress that we are making on tests. At this day's reporting, 254,000 Americans have been tested and received results in coronavirus tests, with slightly more positive. There's a bit of an encouraging word in that for every American. Remember, everyone that's being tested now, with the exception of our healthcare workers, are people that have symptoms that make them think they may have the coronavirus. And as our numbers come in consistently, because the 254,000 does not include all the local hospitals or all the local labs in our states, it's working out to be about 1 in 10 Americans who've been 10 did not. But we'll continue to roll out the testing to provide that resource to the American people. And we're working to make testing happen faster. We expect from word from the commercial labs that we should be caught up on the backlog in testing by the middle of the week. And we are urging today, on the President's behalf, that all labs would prioritize inpatient. Will receive guidance from HHS tomorrow. But on behalf of the President and the White House Coronavirus Task Force, we are urging all commercial labs to prioritize inpatient testing. We want people that have been checked into a hospital that are being treated for what they suspect to be coronavirus to receive those tests more quickly. Also, I'm pleased to report that be in production by the end of March. It actually would be a coronavirus test, the results of which come back in 45 minutes. And we're also working, the FDA is working with manufacturers around the country to come up with even faster, more innovative tests. And as we told our governors in several calls this week, governors and state health officials should simply contact FEMA for the latest information on. We'll be unveiling, with Dr. Bob Redfield in the lead, new guidance for people that work in law enforcement, first responders, people that work in what we call critical infrastructure in the country. It was in early March the CDC issued guidance for people that were asymptomatic or did not have symptoms, but who had been exposed to someone with coronavirus. We gave the podium. CDC will unveil, in cooperation with the Department of Homeland Security, new guidance which will make it possible for people that have been exposed to return to work more quickly by wearing a mask for a certain period of time. Let me also amplify a point on behalf of the President and on behalf of the State Department about Americans abroad. You know, one of China and elsewhere is because the President suspended all travel from China. He suspended travel from Europe and the UK and Ireland. But the State Department is working around the clock to assist Americans who may find themselves overseas. They're able to come home. There's no barrier to Americans coming back to American soil. They're screened themselves unable to find a way home. And as the President said, we've been working very diligently through the State Department to make it possible. Their commercial flights have been chartered. We're also working with the military for a backup on flights. At this point, the State Department has brought more than 3,000 Americans back home. But speaking to the Secretary of State today, he wanted a program at 1-888-407-4747. Or you can go online at step.state.gov. This will allow our embassies and consulates to gather important information about your situation and work to facilitate coronavirus task force. We are 7 days into 15 days, and the American people are responding. Because as we speak about supplies, as we speak about testing, the most important thing every American can do is heed the guidance and the direction from your state and local officials, particularly in areas where we have widespread coronavirus infections. But for every American, that we can do this, America. That we can lessen the magnitude of the coronavirus in our country with the cooperation, compassion, generosity, and prayers of the American people. We can slow the spread, we can protect the most vulnerable, and we can heal our land. So let's do it, America.
Thank you, Mike, very much. Thank you. Thank you. Little things that will take some questions. Maybe you will have some, maybe you won't. That'll be a shock. You'll shock the American public. But I have to say on the testing, if this works out, and we think it might, the new test will be a very simple one, much easier than the existing test, which is quite complex and not a lot of fun to take. And this will be it was good for a small number of people, but not good for the millions of people that we're talking about. And we've made this into a system that no matter where you go in the world, that's where they're going. That's what they want to do. That's how they're going to be doing it should something like this happen again. So our people have done a fantastic job, really a fantastic job. And I hope the new test works out. We'll know fairly soon. I test out. And we certainly are looking forward to that. That will be a very simple test by comparison. Won't be unpleasant at all. And one other thing, the ships. So we have the Mercy, and it's going to California, as you know. That's on the West Coast now. And you have a sister ship that's essentially a twin, one of them. And they are unbelievable what they can do and the capacity. Many operating rooms, they're wartime ships. They're meant for war. Many operating rooms, stainless steel. These rooms are as good as there is anywhere in the nation, actually. I spoke with Governor Cuomo. We had a great conversation today, a number of conversations, actually. He's working very comfort. So you have the Mercy and the Comfort. The Comfort's on the East Coast. And that ship will be coming over the next 3 or 4 weeks. It was in the middle of maintenance, and we are moving the maintenance very, very quickly, and we're also supplying the ship simultaneously. It's actually big supplies going into those ships, big. And that ship will be coming up here. We're making arrangements for that also as to where it's going to be docked. So you have the Mercy and you have the Comfort. They'll be coming up. The Mercy will start very, very quickly. It'll be arriving in Los Angeles pretty soon. So we look forward to that. A question? ABC, go ahead.
Thank you. First of all, Senator Paul testing positive. On top of Senator Paul, now 4 senators are in isolation, and the rules say that in order to vote, they have to be there.
Who are they?
Romney, Senator Lee,
Senator Gardner,
Senator Gardner,
Senator
and
Rick Scott.
Senator Rick Scott. Also, 2 of them were in contact
I
with.
guess Rick is
with
coming
Rand
out.
Paul. With the critical stimulus package vote expected.
Romney's
soon-
in isolation?
Yes.
Yes.
Gee, that's too bad. Go ahead.
Detect sarcasm there,
No.
sir? To allow them to vote remotely if it comes to this critical stimulus.
I was
package.
thinking about it today, and I'm saying, you could have a lot of senators and a lot of House members. I spoke last night with a very, very good man who happens to be in the House, as you know, and he's just started, and he tested positive. So you could have a large number of people in there from Congress. You could have between House and Senate. You could have a large number, and I think it may be a constitutional reason why you should, but we could be in a position where I would certainly be in favor of it, where they could vote from a certain outside location. I would be in favor of it. I was thinking about it today. I mean, we could be in this, look, with what's going on, nobody's ever seen anything like this. You could have a lot of people in there from, but I would be totally in favor of it on a temporary
It
basis.
does seem like negotiations still have a ways to go on the stimulus
Yeah.
package. Are you concerned about the timing at all in the
Well,
best
we
interest
have,
sense?
we have an interesting thing, you know, we all want to get to the same place, but we have different, we want to, and I just wrote this down just a little while ago, we want to protect the worker very much, so do they, so do the Democrats, but ideally they can go back to one of their great companies. You know, you have great companies that are in financial trouble now, and we need money to help those companies so they get back into where they should be, health, you know. Most of these companies 4 weeks ago were having the best year they've ever had. Last year was the best year, almost all of them, other than Boeing, which is incredibly had problems, big percentage of GDP. But we have to be a great company again, I think, shortly. So we have to work with the companies, and they don't want to do that. It's crazy. They don't want to do that. I don't want stock buybacks, so I don't know where the problem is there, but I know that's one of the things that they're talking about. I do not want stock buybacks. I don't want to give a bailout to a company and then have somebody go out and use that money to buy back stock in the company and raise the price and then get a bonus, okay? So I may be